Joining me on the show today is Jenny C. Cohen. Jenny has a long list of huge accomplishments, like a multi-number one international best-selling author, actor, voiceover artist, and comedian, as well as having a master's degree in occupational therapy, and a long list of other professional certifications. But behind the scenes of this impressive list is a story of breast cancer, childhood neglect and sexual abuse, trauma from immigrating to the US from Taiwan, her husband's cancer diagnosis, IVF treatments to conceive her twins, and so many more painful life challenges. I can't wait to dive into the details of how Jenny made it through so much heartbreak and setback and built resilience that helped her become the strong woman, wife, and mother she is today. Jenny, I'm so excited to have you on the show. Thank you for being here.
Oh, Adrienne, thank you so much for having me. It's what an honor and pleasure to be here with your audience.
So, there's a lot for us to unpack today. And so I would just really like to start out with you telling us a little bit about yourself and, your marriage and, growing up in Taiwan and when you came to the US. Like, let's just do like a little mini intro of Jenny, and then we'll kind of jump into some deep stuff.
Great. So I don't know if people can tell, even though my name is Jenny C. Cohen, I am Jewish. No, I'm kidding. I'm Taiwanese. I was born in Taiwan and I came to this country of the wonderful United States when I was 6. And growing up in the States back in the 70s, folks, because I'm 55 this past year, has meant understanding and seeing the personal at home, being a family of immigrants coming to this country, versus being expected to excel outside of it. So I ended up getting a psychology degree at Brandeis University, and I went on to get my master's degree at Boston University for occupational therapy. Mm-hmm. And then I met my wonderful husband. We got married. We ended up with 2 beautiful children through in vitro. And I thought, wow, I have this ideal, wonderful life. Yeah. And then skipped over the part about my husband getting cancer. However, we were still married. We were so wonderfully happy. And then one of our children ended up with type 1 diabetes.
All right. And so that's where I want to dive into the deep stuff, because there were multiple things that happened in your life kind of all at the same time-ish between you and your husband. You mentioned you went through IVF treatments. So take me back to kind of like the beginning of what the first one of those things was that happened in your life. Like, how old were you? How old were your kids? Like, take us back to like the first moment when everything started to change for you.
Oof. I think for most of my life, if most of us are being really honest, right? You think life is good and then something drops out from the bottom of it, and whether or not we acknowledge that, it actually still happens. When I first met my husband in college and we fell in love, right before we got married, his brother passed away. And I had to, while finishing up my master's degree, watch my husband and his family mourn the sudden death of a 26-year-old. Oh. And then when we got married, it was this very bittersweet experience. You're trying to celebrate, and yet there's this huge missing piece out of my husband's family. Yeah. Then we were married and just starting to think about having children, and he ended up with cancer.
Oh, wow.
And I would say that shift really went, whoa, what's happening? I could be a widow.
Right. So this is like shortly after you get married.
Yes. We were just starting to think about having children. I was in my late 20s. Wow. And thinking, I want to have babies, and here I might be a widow. So we had to store things like his sperm, and then get him through his chemotherapy. Yeah. And I was just starting to work in New York City and at the Rusk Institute of Rehabilitation. And I remember my wonderful boss, this amazing woman, saying to me, "You can still work. Your husband's fine. What's he going to do? He's going to lie there just getting chemo." I'm thinking, I love you. You can give away my job, but I will be by my husband's side while he's getting his cycles of chemo. Seriously? And for me, that was one of the pivotal points for me, because I knew my husband would have been fine, Adrienne. I also knew it was extremely important for me to be by his side.
Yeah.
And I think that's
scary. Yeah. I mean, you guys were in your 20s? Were you guys in your 20s?
Yes. He was 26.
Yeah, he's 26. I mean, most people in their 20s are still out partying it up, living the life.
Yeah.
And here you guys are, newly married, wanting to start a family, and your husband has cancer.
Yeah.
And that's not something that most people in their 40s or 50s aren't even equipped of how to handle that. And you're in your 20s.
Yes. And I will say, in light of this, we're all survivors of this global phenomenon, right? There is that survivalship where it wasn't related to age. The suddenness of it, I think everyone could relate to it. Just overnight, life changes. And so for us, it was his need to get back to work as quickly as possible related to the resilience thing, because he just was like, well, I'm fine now. I'm healed. And we went on the Long Island Railroad with him looking literally like he was a Holocaust survivor. He was white and pasty, major surgeries, horrible side effects from the chemotherapy. And he was insistent on going back to work.
Wow.
Yeah.
And so just that like inner drive in him was like, I have to get back to life, like regular life.
Yes. And it ties into this mindset that the nurses said to us. They said to Michael, when he was just about to start his very first cycle of chemo, the nurses said to him, we just want to let you know, because we're clinically in the setting all the time, your mindset is super important. We've had patients, they said that in those days.
Right.
We've had patients come in with curable cancer. And they've decided because they have cancer, they're going to die, and there's nothing we can do. And they're literally gone within 6 months. And we're saying to them, you have a curable cancer. We have a protocol that will save you.
Yeah.
And on the other side of that coin, we've had patients who were told, really, we're just trying to keep you alive for an extra month or so. And then they lived 4 years after.
Right. And it's all about the way that they're viewing it and the way they're thinking about it.
Yes.
Yeah. I'm glad that you brought that up, because I think, first of all, that is surprising to hear. Mental health and like mindset and stuff, I think, is super popular today. But, that many years ago, when your husband was going through his treatments, for them to already have known that then and be talking about that, I think a lot of people dismiss mindset. I know I did for a long time. I'm like, oh, it's like too woo-woo for me, type of stuff. And we just dismiss it, right? And a lot of us think, well, I just need the next best strategy or the best plan or the best tactic or the right doctor or the right treatment or the right this or the right that. And if I just do all the right things or have this right solution come to me, then it's all going to work out. But in fact, what these nurses were saying was truly the outcome of what's going to happen here. Had a big part of that is going to be your mindset around this and staying positive and having hope and believing that you can actually overcome this and can beat this. That's huge.
Really, yes, Adrienne. And it really closely ties into a couple of different things that we found correlated with Michael's recovery and even my recovery after cancer. There needs to be an addressing of your unconscious mindset, because sometimes we talk about the conscious mindset. I'm going to consciously lose weight. And then we don't know why I can't stop eating those really yummy cookies, especially when I've had a conversation with my mom. Because my mom knows how to go after certain words that will set me off on an old loop. Right? And no matter how much I consciously say to myself, I'm going to eat healthy, if I haven't addressed the subconscious things that happened from when I was young, it's really literally this no-win situation. And so for Michael, he could not outthink during the period of time when his white cells completely kaputzed. So we had to start his chemo at one point and give him these shots to up his white cell count. They disappeared. Right? Wow. So we're not talking about when your body is screaming and you're not listening. There's this toggle thing of subconscious, and it's a two-way street, folks. It's not just the mind going to your body. You will listen, and like a drill sergeant. There has to be a receiving of when your body says to you, oh, you need to rest. We're not taught that.
No.
I'm 55. You look so young, Adrienne. I don't know how.
I'm 45. I'm 45.
So we're of that generation where it was no pain, no gain.
Yep.
Right?
Yep. Push through. Right? Suck it up.
Suck it up. We're that generation where you can have it all.
Yeah.
And it's kind of, hold on, folks. Do you really want to have it all? What are you going to do when you have it all? Like, what are you going to have left in you when you have it all?
Yeah.
So part of that has been that reset for us.
Mm-hmm.
When we decided to have children, it was a very, very conscious choice because my husband had testicular cancer.
Yeah.
And then when they did the workup for me, I ended up having all of this internal plumbing issues that we never would have known if Mike didn't have his cancer. And we wouldn't go through, I never would have gone pregnant. We wouldn't have known why unless I went to a specialist.
Right.
So many things going on internally.
Right.
And then that enabled us to have children. And so we were very conscious becoming parents.
Yeah. And so you had to have IVF treatment.
Oh, yeah.
And did you have to do more than one round, or did it take the first round?
It took the first round for us. We were very lucky. And also, I know my making that a complete priority helped.
Mm-hmm. Yeah.
It helped, right? It doesn't necessarily mean that it was this catch-all miraculous thing just because Jenny envisioned it. It happened.
Right.
I took all the protocols and made sure my body was primed and my mind was ready.
Yeah.
I have a story of a mentor who was trying to get pregnant and she couldn't. And then they did some workups and they had found she had severe scarring, and they actually were recommending she have a removal of her uterus. And then she did some unconscious looping blocks and limiting beliefs work. And they traced back to when she had to have an abortion when she was very, very young. And the belief that she did not deserve to be a mother. Once they cleared that, she spontaneously started, the condition, the scarring went away, Adrienne. And now she has 2 beautiful babies.
Wow. So did you carry full term, or tell us about the pregnancy and, was everybody healthy babies? Did everything go well?
So my kids are now almost 25. End of December, they will be 25. So back in those days, anything before 36 weeks was considered premature. Now
yeah.
it's much, much younger. So they were considered a month premature when I had them.
Okay.
I was very, very sick the first 3 months. So I actually was losing weight during the first 3 months. And then once I started to gain weight, it was amazing to be able to eat and keep everything down.
Yeah. Yeah.
And what I found was I had doctors who were used to delivering multiple births, Adrienne. So they were not impressed with my twins. They were like, you can work until you deliver.
They're like, this is a Tuesday for us.
Yes, because they were delivering triplets, quintuplets, septuplets. They didn't really, they were like, you're fine. And I knew my body was slowing down. At the time, I was working with hand specialists. I was a hand specialist, occupational therapist. So we were working with people post-op after hand surgery and traveling between Long Island into New York City via the Long Island Railroad. And I knew after a certain point, I was slowing down. I was 6 months in, and I already looked like I was about to deliver. So I personally took myself out of work at about 7.5 months, because literally one day I got stuck in the sofa, Adrienne. I got stuck in the sofa, no joke.
Wow.
I somehow wedged myself in the corner and could not get out of the sofa for 3 hours. And I was so afraid I was going to be like in an accident when my husband came home.
Right.
It took me 2 hours to wedge my butt out of the corner and get up. That's how big I was towards the end.
Yeah. So you have your babies, and how old was do you have boys, girls?
I had 2 girls that were assigned female at birth, and now one of them is a boy. He identifies as a boy, so he's a trans male. Okay. And another child who is, we'll refer to her as them.
Okay. And which one has how old when you discovered they had type 1 diabetes?
So Daniel was 10. At the time, both my children were elite athletes with rhythmic gymnastics and going through training to get to Junior Olympics.
Okay. And so how did you discover that Daniel had diabetes?
We didn't. I've had to do a lot of work because I had so much guilt over missing all the signs. Here I was, an occupational therapist, and not realizing my son was starting to lose weight, even though he was eating a lot. He wasn't having any accidents, right? He just was having difficulty with physicality. This is a very crazy sport where they require flexibility on top of acrobatics and endurance and tricks meaning skills that he could do before he couldn't do even after 10 attempts, and he would just sit there crying and not understanding why he couldn't hit the skills. Forget about new skills, and I'm talking about tossing an object up in the air, doing somersaults, and then catching it. And he could do all those before, and all of a sudden he couldn't do it. And he couldn't even do it after one somersault or even just tossing and catching, and he would just stand there crying. He has asthma, so one night he was just not feeling well. He ended up with an ear infection, and that exacerbated everything. And so we were sleeping on the floor on the first floor, and he went to the bathroom and he started talking gibberish to me. And I was like, this is not right. We called the ER and said he's having an asthma attack. We went in. They immediately knew it wasn't it, but I'm a distraught mother. And they're telling me we're going to take his blood sugars, and I'm screaming at them, he's not breathing. It's not his, and they're like, no, we have to take, and it turned out he had a blood sugar of, I think it was like 800.
Oh my gosh. Like normal blood sugar is like 60 to 80.
Yeah.
Yeah. It was 800. Like that's on, you're knocking on death's door at that point.
He was literally on the verge of either heart attack or stroke.
Oh my gosh. And he was how old?
10. He was 10. And a lot of parents of type 1 children, right, when they're newly diagnosed, we feel very, very guilty because we're like, why didn't we see the signs? And it had nothing to do with us. It's just the way it manifested in them, So during that time, once he had it, he's a product of his parents. He was very resilient from day one. He had to be the one to put into his skin the apparatus that would deliver the insulin. He only gave himself his own shots. He didn't want anybody doing anything for him.
Wow.
Yeah.
That's pretty impressive at 10 years old to want to take on that responsibility and be willing to do it and even if he was a little bit scared of being like, I'm going to do this anyways.
Yes. He really did want to do it himself. It wasn't, we had to learn how to operate it and then still remember what to do. There were still some emergencies afterwards where he would hit highs and we'd have to wake him up, or the pump would malfunction and we'd have to help him operate it. Those are few and far in between. Daniel has incredible control of his A1C, which is the average of his blood sugars. He sits at about a 5.1, which is unheard of for most people. And then he went on into doing ballet, has a ballet major, and that's like dancing many, many hours during the day.
Yeah, and that's very strenuous and hard on the body and can be challenging for someone with diabetes. We have one of the kids at my son's school, she's a senior now, but she has diabetes as well. And she's a dancer and she's a cheerleader and all the things. And she's got the monitor on all the time. And I can't, she also has alopecia. And so, being a dancer and a cheerleader and like losing your hair it's crazy. And so I know that that's a challenging thing to keep up with. So it's pretty impressive that he was able to do that.
It's the ultimate resilience, and I will say though, part of his recovery now has been to, again, open up that two-way street, because he's now deactivating the conditioning from his coaching.
Yeah.
When he was training to be a junior Olympian. Most of us don't need to train to that level and ignore our bodies.
Yeah. What did that cause a challenge for him in terms of like seeing yourself as like this elite level athlete, and then having to, like, after he moved out, obviously you're not in the Olympics or training for the Olympics forever. Was that hard for him to move away from that identity of like athlete, elite level athlete, and then not having that eventually? Like, what was that transition like for him in that area?
Oh, this is a good story. So both my kids really loved the aspect of the training. And at one point they realized how abusive it was on their bodies at about 12. So they both walked away after winning silver and gold medals for their coach at Junior Olympics. They said, we're done. We're done, Mom. We're done.
Wow.
Because
they chose to walk away.
They chose to walk away. If anything, I wanted to pull them out mid-season, and they said, no, Mom, let us finish this out, and we promise. We're pretty much done. And I was like, okay, are you sure? Yeah. We just, because they were going to competitions where they had judges from other countries, right? So we're in the US, we have a lot of amazing athletes from other countries come here and they become coaches.
Mm.
And they had people say to them, to their faces, their little baby faces, 10, 11, you have no future in this sport. You have no future. You have the wrong proportions. You were too young when you started. They started at 6. We're talking about competing against countries that would hand select children at 4, right?
Yeah.
So 6, they were too old, and the wrong proportions. Literally, they were told, like, your arms and your bodies don't measure up to the right thing.
Oh my gosh.
And they wanted to go to the nationals and show these judges what they thought about that opinion, right? Yeah. So literally, the judges who wrote them off in the past were like, whoa, where do these kids come from? And we did a lot of mindset to train them to the point where they didn't care what people thought.
Yeah. I mean, that's a huge accomplishment of its own, because that's around the age when children really start to pay attention to what other people think about them. They're noticing more about that. They're making it mean something. That's like right when they're getting into those middle school years. I know that's when things change for my children, when they really start to pay attention and care way too much about what other people think of them. And so the fact that your children were even able to, at that age, be able to not let these things that these adults were saying to them and telling them about themselves at a time in your life when you start to really care what other people think about you, and them just being like, I'm going to prove you wrong, I think is really amazing.
Thank you. I'm just really proud of them. After that, they went into competitive dance, and they were with a school where they literally became undefeated because of their training from rhythmic. So, and even now, when they go into any type of new situations, they have this experience, this paid forward experience that we did for them, which I never got, because my parents were all about, you need to be a doctor or a lawyer. There's no other choice. And here we were with my kids in their homeschooling choices so that they could pursue these sports and then later on dance, which then they also walked away from 2 years later, because they were like, this is just the same, but with less safety and training. And they were like, nope, we're done. So, wow. Pretty interesting. Yeah.
Yeah. So obviously, that I think some of us are born with a little bit more stubborn resilience just naturally because of our character, but most of it is learned for most people. And so obviously your children learned that by way of watching their mom and dad. And I know that you also then faced breast cancer. And that unlocked a whole bunch of stuff for you. And so tell us about your breast cancer diagnosis and how old you were, how you found out. Like, let's dive into that stuff, because that's going to unlock even more.
Yes. In my mid-40s, my kids were in their middle teens, and I was so excited. I had been dabbling in belly dancing for years, and I thought, I'm ready to go compete. And I ended up winning a contest in 2014, and part of my win was go to Germany. So I went to Germany, and I placed second in 9 people competition, which is huge for this type of small type of niche thing. And I thought, wow, I'm being noticed. I'm ready to launch my career. And then I came home and found a lump, and that started my breast cancer surgery. That whole journey of, whoa, that's not what's meant for you. I was ready to be seen.
Yeah.
And then I got breast cancer, and it was 18 months of 16 cycles of chemotherapy, then surgery. I was really lucky I got to keep my boobs. I had a friend who was ready to do a boob job with me. She's like, all right, I'm ready. My boobs are down to my knees. Let's do it. And I was like, yes, let's do it for science. And the doctor said, nah, you can keep your boobs. I'm like, all right. Okay. So then after that was another 35 cycles of radiation. And then an additional year of infusions.
Oh my gosh.
I know.
So I have, thankfully in my own personal life, I have not had many family members with cancer or anybody super close to me with cancer. And so when I hear people say like chemotherapy and radiation or infusions, I feel like I don't have a clear picture in my mind of what that actually does to someone physically, mentally, emotionally, how it affects their family. You're throwing out all these big numbers of like 35 treatments of this and this. And like, what does that actually look like in your life? How does that Is it painful? Do you feel sick? Is it like, tell us about that process, because I think a lot of people don't actually know, because and like we said, there's a whole mental component to it too. And so I want you to talk a little bit more about that.
All right. When I found that lump, I had already done 8 months of vegan diet, strength training, working out. I was at my best physicality. I was at my pre-twins baby weight. And I found this lump.
So and again, we all have this idea that, like, if I take good care of myself, right, this won't happen to me.
Later on, we realized it had to do with just past traumas I hadn't resolved, plus the fact that the month before, my husband ended up having emergency bowel surgery. So like, I thought I was going to be a widow, right? So there's a lot of stress in that recovery on top of my son being diagnosed with type 1, and I'm managing it all by myself. I digress. So in the breast cancer whole journey was, you're told you need to start chemo. And we have no idea what that means. And basically, different clinics have different procedures. The bottom line is, the very first treatment, you don't really feel different because they've come up with all these amazing drugs to block your body's reaction. So the first treatment, you're a little bit nervous, right? And most oncology protocols are one nurse gets 1 or 2 tries on you to poke you to get an IV started. And if they fail, a second one comes, and if they fail after 1 or 2 pokes, a third one comes. So that when you first start chemotherapy, your nurse gets you on the first try, maybe second try if you're nervous, and your arteries start to kind of get smaller just from nervousness, right?
Right.
And they'll pump you full of drugs to kind of sedate you. And then when the chemo comes up, the nurses will gown up, like,
because they're injecting poison into your body.
It's radioactive poisoning that they're putting into your body. And you might fall asleep, you might wake up. For me, the 16 cycles, 4 of them was what they called the Red Death. So it's this bright red chemotherapy thing. And they warn you, oh, don't get nervous because we've hydrated you. When you get up to pee, it will be red or pink or bright pink. And I'm thinking it can't be that quick. Well, 20 minutes in, I had to go to the bathroom after being all that prep IVs before. And literally, it was a shock to see going to the bathroom, and it's all bright pink, bright, almost red. And so you're thinking, wow, this is going through my system. However, because the medication you're under keeps you from fully processing, because they kind of have to prevent you from going to flight response.
Right.
What normal person would sit there and let you be pumped with poison that goes through everything, including your blood-brain barrier? It goes into your brain. You get you get chemo brain. You have brain damage from it, right? Either way, that first one, you're thinking, oh, this is nothing, because you're high from the 20 times X normal Benadryl dose that they put into your body, so you don't have a reaction. You go home. I went home and thought, oh, this is great. This is fine. Let's go and take a walk. I made it maybe 100 feet and realized, oh no, all the drugs are starting to wear off. I don't feel well. And you go back home, and that's the beginning of your reality. This is only going to get worse.
Yeah. So
every subsequent treatment, you get sicker and sicker. And the first week, you think, oh, I'm going to keep my hair. And you might get the now it's very in vogue to get the ice cap. And it doesn't necessarily mean that it prevents full hair loss, folks, unless you can withstand an ice cold cap on your head for a lot of the time. Does that make sense?
Yeah.
And none of the doctors told me about it. And so I didn't even realize that, because the chemotherapy goes to everywhere, including your fingertips and your lower legs, you can get neuropathies from the chemo damage.
Yeah.
People will wear cold gloves. I was really afraid of the cold. It really made me uncomfortable. So I didn't do any of that. And then I ended up with nerve damage in my hands. I was dropping. You want to avoid all the glass things because you'll drop everything. I stubbed my toe and broke a toe and didn't even feel the pain.
Oh my gosh.
That's how bad it is towards the end. You end up developing an inability to put anything metal in your mouth because it damages your taste buds. So I was using, thank God I was like Asian, I had chopsticks. They're wooden. So I was using wooden chopsticks, drinking out of glass, nothing metal. It just drove me nuts. Right? Then
I'm sorry, go ahead. And then I'm going to ask you a question about that.
Go ahead.
As I'm sitting here listening to you say this, and we've already multiple times in this conversation with other things that your kids and your husband went through, we've been talking about keeping a positive mindset. And as I'm sitting here listening to you talk about, and you haven't even finished yet, what it was like to go through that, I'm starting to feel anxious. And just listening to you talk about it. And you were saying that like the nurses, and I used to be a paramedic in the Air Force, so I've started a million IVs in my life. And you were talking about like the nervousness and the anxiety will shut down and constrict your arteries, which makes it very difficult for them to then put an IV in. And so the more scared and the more fearful you are, and you're like, oh my gosh, I'm about to get my first round of chemotherapy. Like I have cancer. I'm hoping this is going to keep me from dying. Like all the thoughts that you're having, physically, your body is going to react to that. And as you know, everybody knows that chemo is this radioactive poison, and it's like, yeah, it kills the bad stuff, but it kills the good stuff too. And I don't know, like, how do you even stay positive as you're thinking about, like you said, you're sitting there thinking about all of these things that you're putting into your body, the way that you're feeling physically, that you're losing, you can't hold anything, you can't put certain things in your mouth. Like, how in the world do you continue to have hope and think positive when you have all these signs, physical signs, that something negative is happening?
I got a secret. Ready? Remember, I wanted to be the belly dancer? I danced throughout all my chemo. Wow. I was doing a 100-day improv challenge, and I did 4 of those during that whole cycle, because literally every day I danced a little bit. Even on the days I couldn't move, I just sat in my chair. And I have thousands of files of me dancing through it. Because dancing before I got cancer was one of the few things I felt safe in my body, because I never even realized that I hadn't processed all this trauma from my childhood. And what happens is, when we're not taught to process trauma, we just put Band-Aids over it, layers and layers of backup systems. When you're going through cancer, it takes away all your backup systems. Yeah. It just breaks you completely, outside, inside, everything. You can't even look in the mirror without being reminded, because your real hair is gone. You're either wearing a wig or head cap. For me, like the caveat with people shaving their heads for their friends, I was like, please no one shave your head, because I don't want to see you and think you're sick like me, because my brain thinks that. I need to see you healthy so I can achieve that in my head.
Interesting.
Just so you know, right? It's different if you have a child with cancer. That's different. Children need to feel left alone. Adults, it can trick us into thinking we're surrounded by sickness, just to give you that caveat. So that's another thing. The subconscious will play with our minds a little bit, right? So for me, dancing was the key. I was going to events. Friends were coming and driving me to events. I was doing everything I could to keep in dancing. Even if you can't physically dance, when you're at a dance event, there's an exchange of energy amongst the dancers that's actually very healing and very replenishing.
So even if you couldn't dance, they would take you to watch people dance.
I would, in the space, I would sign up for the workshop and do 1 or 2 things and then sit. And I was done, right? Or there were a couple of events during the chemo I couldn't teach, I would attend. And if they were inviting me to perform, I would do only some workshops on the other days. And the days I was performing, I wouldn't dance. I would just sit in the space and then prep myself to perform, and then I'd be wiped out, right? So you had to do this energy conservation thing. However, just being in that space, huge difference for me. Huge difference.
I don't know if I've ever heard anybody say anything like that. Like I said, I haven't known a ton of people in my life with cancer, but even the people that I've known or stories that I've heard, that's really interesting, because there's this, forgive me for using this word, but there's like this dying of your body that's happening when you're going through chemo and radiation in the inside, right? And like you said, and then it's reflected on the outside as you're losing your hair and other things that are happening. And dance, whether you've been a dancer or not, anybody listening to this has seen at some point in time in their life someone dancing, whether it was at a ballet, whether it was just hip hop dancing, like dance at a school part, whatever it is. But you're right that when you dance, you feel so alive, right?
Yes.
Like there's this energy that goes through your body when you're dancing that can completely change your state of mind. It can completely change. And for you to turn to something like, when you're saying it to me right now, it's making so much sense. Like, of course you would do something that makes your body feel so alive when it's dying inside, it's being killed by chemotherapy. And I don't know, I just have this beautiful picture in my head of like this amazing, full of life energy, like lifting up and pushing out the negative and the bad and the hard and the chemo and all the stuff. Like,
yes.
Yeah, it's just interesting. I'm having that vision right now of what that would be like.
Yes. Oh my gosh. So remember I had a realization after I was done how scary it was to sit there and be administered to.
Yeah.
You're literally in freeze response. You know, they talk about fight, flight, there's freeze, there's fawn now.
Mm-hmm.
They're coming up with all these different responses when you're feeling powerless.
Yeah.
I couldn't run away. I wanted to be alive to see my kids grow up. That was why I was going through Western medicine. So many people were telling me about all these other ways where you could get, what is it, like juice cocktails and coffee enemas would get the cancer out of your body. And I'm sure they worked. I didn't want a chance it couldn't work. So I went ultra Western medicine, where they literally were saying, we're 95% sure we can cure you. It's just, you may not look pretty by the end of it. And I was like, seriously? Yeah. I mean, during the chemotherapy, so we're talking about 16 cycles of it. So 4 of the Red Death and then 12 of this thing called the T. The T did the most damage of my hands and feet. And so I'm still going to these events and realizing, wait, I can't feel my body below the knees.
Oh my gosh.
I don't know where my feet are, and I'm a dancer. And then when I said this to the doctors, they said, oh, would you like us to decrease the T? And I was like, oh, do you mean that means I don't need it?
Right.
And they were, oh, no, you need it. However, your quality of life is very important to us. You know, you're a dancer, and we wouldn't want you not to feel your feet. And I'm thinking, wait a minute, I don't need to be a dancer if you can't cure my cancer 100% if you decrease the T. I don't need to be a dancer. I want to see my kids grow up.
Right.
So I elected, even though they were saying, oh, we could decrease it, I elected to do the full cycle.
Yeah.
You know?
I mean, because you're literally choosing between life and death.
Yes. And I remember saying to the doctors, I think I feel it coming back. And they were like, no, it's in your head. It's not coming back. The damage is permanent.
Oh, wow.
The damage is permanent. Yeah, it's permanent damage. It doesn't come back. The chemo is that poisonous. It kind of just destroys it. Like even now, so I'm an occupational therapist, right? And I was homeschooling my kids and I accidentally let my licensure and registration expire. That's an important thing to do to practice, to be a licensed OT. I let that expire and I was going to go back to doing it. And part of OT is that we will do these little sensory filaments to see what your sense of touch is, to know for safety when you're cooking. Yeah. And I was doing hand therapy, so I knew how to use them. And we partnered up and I'm poking my partner with these little filaments and she's feeling them all and telling me what side. And it's my turn. I feel nothing the first 3 filaments. And she's poking me. I feel nothing. I'm like, I don't, you don't, and she's like going to the bigger and bigger. Yeah. And then finally I felt it. And just when in my recovery, Adrienne, there were times I would give myself first and secondary burns on my hands because I would not feel quick enough to pull my hands away.
Right. Wow. I never knew that. I never knew that it can happen. And they tell you that it's permanent. Is it definitely permanent for everyone or does it come back?
We learn to train ourselves to make up for it. I've convinced myself some of it has come back. I don't think it's come back.
Yeah.
You know, it's just been the exchange. The caveat too, I want to let your audience know is that I ended up, so I'm showing you a scar here. I got a, what do you call this? A port. A port, because after session 4 of the ANC, the Red Death, I had 12 more chemotherapies and then another year of this infusion because my type of cancer, they found something that would prevent it from coming back through that way of being stimulated. they were like, oh, we can't get your arteries. Like, we went through 3 nurses that day. So I was poked 3 or 4 times. And I'm sorry, 3 or 4 times by 3 or 4 nurses. So I was up to like 10 pokes.
Yeah.
Okay. Yeah. And just so you know, oftentimes when they start chemo, they'll start distally, fingertips, and move up the arm, because if they go here along the elbow, they can't go back to your fingers. So I had Band-Aids all up in my arms, in my wrist, up my forearm. And they're like, it's time to do the port. And I was like, why didn't you start the port day 1? And
could we have just started with that?
Yes. And their thing is, it's very traumatic. And I didn't realize what they meant until I got it in. So it's an ambulatory surgery. You're awake for it. And they do a little incision, and they put this cute little pod thing underneath the surfaces of your skin, so they pull your skin back over it. And then the actual port is this tubing that goes up into your aorta, that big major vessel, and it still goes down into the aorta closer to your heart.
Oof.
I did not know that. I thought it was this long, like 4 inches. It was actually 18 to 20 inches long going in. I did not know that, right? And then I thought, oh, so the port means that you don't have to poke me. Wrong. They don't have to poke your arteries on your arm, but they still have to poke through the skin that's stretched taut over that little apparatus to pump into your chemo. And you can feel it going through your aorta and your heart when they go to the pump.
Yeah, I bet. I'm just like feeling all kinds of stuff in my neck right now, because I'm like, I'm sure you can feel. I mean, that's such a major artery, like you said. Like I would imagine you could feel it going through you.
Yes, so I had 5 through 16 to get through, right? And they said, oh, we have a numbing medication you put over here, and then you put a little sticky thing on top, like a saran wrap thing, to keep it here to kind of numb out this, because it really hurts when they poke through that skin.
Yeah.
And no one told me you really want to do a really thick ice cream, like almost like a cake coating of it.
Right.
And you want to do it a good 30 minutes before.
Right. Yeah. It's like how we used to do when we'd have to put IVs in babies and stuff. We'd put like a numbing cream on there and then cover it and let it sit for at least 30 minutes before we go and put the IV in them. Yeah.
Yeah. And the interesting thing was, for me, I was always afraid of needles. When I was growing up, my father would have to hold me down for blood draws all the way up into my teenage years. Like, I would cry. And I raised my kids very differently. They always knew when needles were coming. We never hid them from them. So it was never a traumatic thing.
Right.
And then later on, I found out that I was sick a lot as a baby. And back in those days, they just gave baby shots. They didn't give medications.
Right. So you going through breast cancer treatment wasn't even, it was just the beginning, honestly, of your journey. It wasn't like, oh, Jenny got cancer and then we're going to like wrap this up and be like, and Jenny's great today and wonderful. Like, there was a lot of stuff that came through that journey of your breast cancer treatment, the healing. Like, what started to happen? Like, what came from that? And I know that there's some rough stuff, but what I'm hoping that people are going to get from this as we're going through is realizing that, like, I mean, you were hit with one thing after another, and a lot of people would just be in that chemo place and getting treatments and stuff and just be like, I'm ready to give up. And you didn't. And so let's talk about some of the things that you uncovered as you were healing and going through your breast cancer treatments.
I discovered I love telling stories, and I continue to do that. I didn't realize after my treatment was done, I was starting to use the dance as a way to escape my life. Because it ended up becoming a complete distraction, almost like a poison, to be honest. Because going through cancer destroyed all of my backup systems, and I was disassociating through my dance. And then 2017, so 2 years after I was done, I was going to go back and be a belly dancing person again, right? Yeah. And we didn't realize that my kids were going into distress. And one day my child we were way in Boston. They were visiting their friends, and this child tells me in the hotel room, "I want to talk to you, Mom." And I'm like, "Well, what do you want?" I'm thinking she's going to thank me for going to Boston to see her friends. And she pulls up her shorts and shows me these scars from self-harm. So trigger warning to I won't go into a lot of details. Just they were deep grooves. And then, "I don't want to be alive much longer, Mom." And I'm like, "What?" Okay, I'm an OT, right? I worked in pediatric psych. I know what to do. She's not going to be admitted. And I'm like, lock up the knives, set up therapy. We go home, and I'm thinking, okay, got this. 2 weeks later, because I still wasn't present, Adrienne, she had a severe relapse, like severe. She had found a brand new fish fillet knife I missed. So she waited for me to leave the house and go to a workshop right here in Salt Lake City. And her brother and her father fell asleep, and she locked herself up in the bathroom and just went at it. And they woke up, and they're trying to break the door down. And she finally opens it up, and then they're calling me, and I come home, and I'm just bawling, realizing I'm going to lose my baby. Like, I'm just butterflying together her arm. Yeah. And she's looking at me like she's not even there. There's like nothing behind her eyes. Adrienne.
Yeah.
And I was like, okay, I'm going to lose my baby. Like, this beautiful, precious baby gifted to me that picked me as their mom. I've not been present, and I'm going to lose them. And that's when I started to be like, all right, how do I get present? Okay, I like to dance. I'm going to do breath work. I'm going to start breathing and tuning into 5 senses. That's one of the few things I've always been able to consistently click into. I'm going to do that during dancing. Besides walking my dogs, I walked off the sidewalk a couple of times. So people, please practice this at home first before you start adding in activities. Yeah, I've done that. Like, walked into like poles and stuff. So, and that told me how not present I was in my body. Yeah. You would think walking down the street, it should be simple. How many times have we all driven somewhere and then don't remember how we got there?
Yeah. We arrived, but we don't even remember the drive.
Right? Or I'm thinking, well, what happened to today? Did I flow through today? So it was that stopping of that tuning out and just getting through my days. And from fast forwarding from there until now, I've now done a lot of unconscious work, looking at old traumas I never resolved. And that opened it up, because as we have healed my precious baby and gone through all of the healings, it's really made me focus on what did I not resolve so that I can be present. So now I'm on this call with you, right? And launching my business. And I know instantaneously when my child's in danger. I know. I'm so connected. There's no, you know what I mean? Like, we've set up systems, they're healing. And at the same time, also, I can just immediately know.
So tell me what that, when people say be present, what does that mean to you?
Being present is that I've laid down the groundwork so that I am an open channel between what I want to do up here, what my body can do, that going back and forth, and it's tied into what is my life's purpose. I tune into that every day. There's a process I do through my evolved neurolinguistic programming. I'm a master practitioner in that, and it's talking, and it's may I do it with you?
Sure.
Yeah, I would love to give this to your audience today.
Yeah, okay. Tell them what to do.
So so clearing layers of denial means that there's 10% of you and I right here, and 10% of your listeners that are conscious self. And then there's another 90% of us in the background deciding whether or not what I'm saying, what you're saying, what's happening around us, almost before we even reacted, the subconscious has already set up how we're going to react, right? Because it's based on these systems of safety that have been set up since we were little. When we do clearing denial, we're opening ourselves up to what's our own truth, and then being able to decide what's in my best interest for my best well-being. Okay, that's one of the ways I stay present. So the first thing you're going to do is take your 2 little fingers, find your collarbone, and come underneath here, and you're going to do little circles. Please keep your eyes open, audience who's listening in. All right. And you're going to just do 3 regular breaths, 3 regular circles, little circles. And this is, I know my truth. Okay. And then the second one you're going to do is take your left hand, put it on top of your belly button. Your right hand's going to go to that bony prominence behind your ear, go below it to that soft spot. And you're going to just breathe now normally, keep your eyeballs open. And this is, I can speak my truth. Eyeballs open. And then once you're done with those 3 breaths, you're going to switch your hands. Right hand to belly button, left hand to behind that ear to the soft spot. And this is, I can hear my truth. Meaning, if someone speaks it and it's truth for you, you're going to hear it. And if it's not, you're going to hear it. Eyes open. And once you're done with your 3 normal breaths, you're going to take the left hand, thumb to between your eyebrows, turning your head so your palm is on top like this, eyeballs open. Yep. Beautiful. Turn your head to it. Yes. Beautiful job, Adrienne.
That's hard to do.
I know. And then sometimes it just helps to turn your whole head. Just keep your eyeballs open. This is, I can feel my truth. Eyeballs open. Because, kinesthetically, your body, you can do muscle testing to find out when something serves you or it doesn't.
Mm-hmm.
Right? And then switch your hands, other hand.
Mm-hmm.
I can see my truth. Almost done. And then fingertips right above your top of your head. Yeah, in alignment with your ears. This is, I can accept my truth. And then switch last one. We're just going to do 7 layers today. And this is, I can let go of old truths that don't serve me and accept new truths to flow that serve me. Eyeballs open. Beautiful. So oftentimes, to be present between my mind and my body, I want to tie it into what's my truth and also my life's purpose. And I dance every day.
And so how many times a day do you do that exercise? Or when do you do it?
I do that. I have very particular physical therapy exercises I do to realign my SI joint. And I do that during then. So I do that every day.
Okay.
I start in the morning. You don't have to do it every day. Like, you do it once a week and see how that helps your day or the day after. And if you like it, do it more.
And so what is the overall outcome the result that will happen from people doing that exercise on a daily basis?
Part of my being resilient is that I have been able to find my own truth. What does that mean to you? So when you do that every day, it reminds you of what are you here for, folks?
Yeah.
What is your purpose? Why did you like to come into this type of life? Yeah. A lot of time, and we're going to go a little woo-woo. Ask your audience's indulgence. Oftentimes in life, I hear your puppy. So I'm going to backtrack. There's a Carl Jung quote. Until you make the unconscious conscious, life will happen to you and you will call it fate. Right? Part of what we're conditioned to think is, oh, life happens to you.
Yep.
You have no choice. You got to go with the flow. Yeah?
Yep.
And I would love for us to start sitting in the, I am already empowered. No one needs to give me power. I have power. The life you're in right now is in part your creation. Yep. Some of it is, and we have the power to shift it. Some of it is, what is your truth? You want to get in touch with that, and then you can shift in that direction. Sometimes people think, oh, this is my truth, and it's really not. It's something you were conditioned to believe, and until you address that, it's very hard to get what you truly are meant to do here in this lifetime.
Yeah. Well, we have this thing called the resiliency playbook, and there's 10 things that I put in there to help people build resilience. And one of those things is about focusing on the truth, and being really in touch with what the truth is. And when we start to believe either subconsciously or consciously things that are not true, then we start to have feelings that cause us to feel certain ways that then cause us to behave in certain ways and then to believe certain things. And so, you know, I 100% believe in people being in touch with what is the truth. And so you being able to take people through an exercise of them being able to get in touch with, you know, that and be thinking about it. Cause I don't even think I, from what I see from people around me, from my own children, from whatever, is that we don't even consider the fact that we can change our thoughts or what to do with the thoughts that we have, or that we don't have to believe those things. And that, you know, like, I think people, like you said, it's kind of like, oh, these things happen to me and I can't control many of them. And the people who believe that, whether by just lack of knowing or understanding, get stuck in these places where they feel out of control in their life, where they feel like I can't do anything about this. And they give up the power that they have. And there's a saying, you know, that I believe strongly is that life doesn't happen to us, it happens for us.
Mm-hmm.
And that is just simply choosing to look at the things in life differently and decide what is true and what isn't. And when you believe that life happens to you, then, like you said, you believe that you don't have any control over it, that it's just fate, that it's whatever. And that's a really hopeless, powerless place to be. And that can affect your outcomes of cancer treatments and other treatments and sports and all the other things that we've talked about today. And so, you know, being able to, part of resiliency is being able to take your thoughts captive and being able to change the way you think and being able to focus on truth. And so I love what you've shared with this exercise that you do. And I know that there's a lot of other things that you do as well, to help people get back in touch with that. Because I have to do that often, where I have to say, I even will ask myself, is this true?
Yes.
And that's a really good place to start.
I love that. And also, there's this one thing we talk about that I've learned a lot about perspective, because depending on where you're standing, your truth is a little bit different, right? And so the exercise I just did is to have people figure out what their own truth is. Mm-hmm. Because your truth may not be a truth for someone else, and that's okay. Sometimes we're so worried. Healing has to be in community, and yet sometimes the decisions that get us there are very individual. Mm-hmm. They vary differently. How we get there, it has to be different because we're still uniquely different in our own existence.
Yeah. 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 So tell us more about what you do today and how this has transformed your life, the work that you're doing. Like, I want our audience to know more about you and what life looks like today.
All right. So these days I am on the mission to get the world dancing in a very present state. I have a program launching in January officially, so that the world can dance. I have an app launching, and it's all somatically based though, because it's one thing to say, oh, just dance, just turn on music and dance. And yes, that's really important. There's also a shift that can be done during the dancing when you have someone who knows the feelings that can be released during the movement. We all store memories in our bodies. The book, The Body Keeps Score, right? So one of the core things about belly dancing is oftentimes when you're belly dancing and doing this pelvic movement, you'll start crying and you won't know why. And you want to be with someone that can help you walk through that. Again, it's not someone's going to tell you what you're feeling and how to process it. It's going to be someone that just gives you some ideas of where to go and how to feel about it. Yeah. And then on top of that is, once we get you moving, we do have all these unconscious loops that keep us safe, even if it's not good for us, because that's all the unconscious knows. And we have programs launching in that direction. And you know how you said, Adrienne, I oftentimes have to remind myself, right? Or what is your truth? What is your truth? And sometimes, oftentimes, on a daily basis, I would say we need to do mental push-ups to keep us on the focus.
Yeah.
I have a training program that does repetitions for mental fitness. That's
Wow.
part of the membership because, we have therapists, but therapists can't live with us.
No. And you go see them once a week or every other week or whatever. And then you're like, what do I do in the in-between time?
Yes. And so these are all geared towards helping people figure out their truth at your own timeline. That's the important part.
Yeah. So if people want to know more about your dance program, the things you've talked about here, give us a website, or where should they go to follow you to get more information?
Yes. Please go to danceandheal.com. That is where you get a gift of a somatically centered cardio dance class with me, and then a myofascial release stretching thing, a whole series. So it's a full hour. You can do half-hour sections.
Mm-hmm.
And then from there, you will be notified about the launch of the membership.
Awesome. Well, Jenny, I just have to say, like, hearing your story, and I know there's a lot of things that we didn't even go into that have happened in your life, but you are really, to me, the true picture of resilience, of someone that just took a lot of hits and stayed focused on your healing and getting through it and just kept going. And I'm honored that you came on the show today and shared your story. And I know a lot of people will benefit from what you shared today. So thank you.
Thank you so much for having me.
Today's story was a remarkable testament to human resilience, courage, and perseverance. I encourage you to carry their lessons with you to use as an opportunity to grow, evolve, and strengthen your resolve. As a special gift for my listeners, I've put together a free guide called the Resilience Playbook. If you've ever felt stuck or powerless, I'm sharing 10 resilience factors to give you hope, inspiration, and empowerment. Get your free copy today and start turning your setbacks into comebacks. Find me on Instagram easily by searching my name and DM me the word playbook to get your copy right now, or I've also put the link in the show notes. You can do hard things, my friend. Strength lies within you, just waiting to be unveiled. Until next time, stay strong, stay hopeful, and most importantly, stay resilient.